non-judgmental stance and radical acceptance. In domain of therapeutic practices, the constructs of non-judgmental stance and radical acceptance are pivotal in fostering a milieu conducive to healing. These concepts, deeply rooted in the principles of dialectical behavior therapy, offer profound implications for the therapeutic alliance, which is predicated on mutual respect, empathy, and understanding. To fully appreciate their significance, it is essential to traverse the theoretical underpinnings, practical applications, and the broader interdisciplinary influences these concepts wield in the therapeutic context. Non-judgmental stance and radical acceptance are symbiotically linked, serving as both a philosophical underpinning and practical methodology in therapeutic engagements. The non-judgmental stance entails a deliberate suspension of evaluative judgments, enabling therapists to engage with clients in a manner that is devoid of preconceived biases or assumptions. This stance is not merely an absence of judgment, but rather an active, mindful awareness that recognizes the client's inherent worth without attributing moral or qualitative assessments to their experiences or behaviors. It is a stance of openness and curiosity, allowing therapists to explore a client's narrative from a place of genuine interest and compassion. Pause. Radical acceptance, on the other hand, demands the unconditional acceptance of reality as it is, without resorting to denial, distortion, or evasion. This principle encourages clients to acknowledge their circumstances and emotions authentically, facilitating a pathway toward change and healing. Radical acceptance does not imply agreement or resignation, but rather an acknowledgement of reality's complexity and oftentimes unchangeable nature. It serves as a counterbalance to resistance, fostering a space where emotional turbulence can give way to equanimity and resilience. Pause. In practice, these principles manifest through specific therapeutic strategies that enhance the therapeutic alliance. A non-judgmental stance encourages therapists to employ reflective listening, validation, and empathic engagement. By mirroring clients' emotions and experiences without imposition of personal biases, therapists create a secure environment where clients feel seen and heard, which is foundational to the healing process. Radical acceptance, meanwhile, is operationalized through mindfulness exercises, distress tolerance skills, and narrative reframing, empowering clients to engage with their realities with clarity and acceptance. Competing perspectives offer insightful critiques of these concepts, highlighting the challenges and limitations inherent in their application. Critics argue that the non-judgmental stance can inadvertently engender passivity, where therapists may avoid necessary confrontations or interventions for fear of imposing judgments. This critique underscores the need for a nuanced balance between acceptance and change, a dialectical synthesis that is central to DBT. Conversely, radical acceptance may be perceived as an impediment to active change, with some suggesting it risks fostering complacency. However, proponents contend that true acceptance is paradoxically a catalyst for change, as it liberates individuals from the paralyzing grip of denial and resistance. Pause. Emerging frameworks and novel case studies further illuminate the practical implementation and benefits of these principles. For instance, acceptance and commitment therapy, which shares philosophical commonalities with DBT, emphasizes the acceptance of thoughts and feelings as a means to foster psychological flexibility. This integrative approach has been instrumental in broadening the applicability of radical acceptance beyond DBT, demonstrating its efficacy in treating a range of psychological disorders, including anxiety and depression. The integration of non-judgmental stance and radical acceptance within the broader therapeutic landscape necessitates a consideration of interdisciplinary influences. For example, neurobiological research underscores the impact of these principles on brain function, highlighting how acceptance practices can modulate neural circuits, associated with emotion regulation and cognitive processing. This intersection of psychology and neuroscience enriches our understanding of the mechanisms through which these practices exert their therapeutic effects. To ground these theoretical insights, consider the following case studies, which elucidate the transformative potential of non-judgmental stance and radical acceptance across diverse contexts. The first case study involves a client diagnosed with borderline personality disorder, struggling with pervasive feelings of worthlessness and emotional dysregulation. Through the application of a non-judgmental stance, the therapist validates the client's experiences without pathologizing them, fostering a sense of safety and trust. Concurrently, radical acceptance is employed to help the client acknowledge and accept their emotional experiences without resorting to maladaptive coping mechanisms. Over time, this approach facilitates the client's capacity to regulate emotions, enhance self-esteem, and engage in healthier interpersonal relationships. The second case study focuses on a veteran grappling with post-traumatic stress disorder. Here, the therapist employs radical acceptance to address the veteran's resistance to confronting traumatic memories. By accepting the reality of their past experiences without judgment, the veteran is able to process these memories in a therapeutic setting, reducing their emotional charge and fostering post-traumatic growth. The therapist's non-judgmental stance encourages the veteran to explore their identity beyond the trauma, empowering them to reclaim agency over their life narrative. Through these case studies, it becomes evident that non-judgmental stance and radical acceptance are not panaceas, but integral components of a comprehensive therapeutic approach. Their efficacy lies in their capacity to cultivate an environment of safety, trust, and authenticity, enabling clients to navigate the complexities of their emotional landscapes with resilience and insight. In conclusion, the principles of non-judgmental stance and radical acceptance represent vital cornerstones in the edifice of therapeutic practice. Their theoretical and practical applications offer profound implications for the therapeutic alliance, underscoring the importance of empathy, understanding, and acceptance in the healing process. As the therapeutic field continues to evolve, these principles will undoubtedly remain at the forefront, guiding practitioners in their quest to build healing relationships that transcend the limitations of traditional therapeutic paradigms. End quote.